In this video we will discuss all about coronavirus, its origin, medicines and vaccines briefly. What is COVID-19? COVID-19 is a highly infectious disease caused by the coronavirus. It was first identified in Wuhan, China in December 2019 and has since spread to become a global pandemic. The disease primarily spreads through respiratory droplets when an infected person talks, coughs, or sneezes. Symptoms can vary from asymptomatic to severe respiratory illness and can also include fever, cough, and shortness of breath. The best way to prevent the spread of the disease is to practice social distancing, washing hands frequently, wearing a mask, and getting vaccinated. How, where and when coronavirus started spread? The exact origin of the coronavirus is not yet confirmed. However, it is believed that it originated from animals, most likely bats, and was transmitted to humans in a seafood market in Wuhan, China in December 2019. The virus, officially named COVID-19, quickly spread within China and by January 2020 had spread to other parts of the world. The World Health Organization, WHO, declared the coronavirus outbreak a global pandemic on 11 March 2020 as it had spread to more than 100 countries with increasing cases and deaths. The virus is primarily spread through respiratory droplets or contact with contaminated surfaces, and it can cause fever, cough, and other respiratory symptoms, which can be severe in some cases. Governments around the world have implemented various measures such as lockdowns, social distancing, and travel restrictions to slow the spread of the virus. What are the COVID-19 variants? COVID-19 variants are new strains of the coronavirus that have developed mutations in their genetic material. These changes can make the virus more contagious, more transmissible, or even more resistant to existing vaccines and treatments. Some of the most well-known COVID-19 variants include the Delta variant, B.1.617.2, Alpha variant, B.1.1.7, Beta variant, B.1.351, Gamma variant, P.1, and Lambda variant, C.37. As the virus continues to spread and mutate, new variants are likely to emerge over time. What is the known remedy for COVID-19? Some general tips for preventing the spread of COVID-19 include practicing good hand hygiene, wearing a mask in public settings, avoiding close contact with others, and staying home when feeling unwell. If you or someone you know is experiencing COVID-19 symptoms, seek medical attention right away. Please refer to trusted healthcare sources and guidelines for preventive measures and treatments for COVID-19. What are the general medicines for corona infection? Until now, there is no specific medicine approved by the World Health Organization, WHO, or any other regulatory authority for the treatment of COVID-19. However, certain therapies and drugs have been used in certain cases under strict medical supervision, including Remdesivir, which was originally developed to treat Ebola virus disease; Dexamethasone, a steroid that reduces inflammation; Tocilizumab, a drug used to treat rheumatoid arthritis; Convalescent plasma therapy, which involves transfusing plasma, the liquid portion of blood, from recovered COVID-19 patients into those who are currently infected. It is important to note that these treatments are not universally effective and should only be used under medical supervision. The best way to prevent COVID-19 is to follow the recommended public health measures, including getting vaccinated, wearing a mask, practicing physical distancing, and washing your hands frequently. What are the effective vaccines for coronavirus? There are currently several vaccines available for the COVID-19 coronavirus, including Pfizer-BioNTech vaccine, Moderna vaccine, Johnson & Johnson vaccine, Janssen, AstraZeneca vaccine, Sinovac vaccine, Sputnik V vaccine, Comirnaty, original name Omicron, Vaxzevria, Spikevax, CoronaVac, Covaxin, Covovax, Nuvaxovid, Convidecia, Covishield. All of these vaccines have been shown to be effective in preventing COVID-19 infection and reducing the severity of the disease. It is recommended to get vaccinated as soon as possible to protect yourself and those around you. What is vaccination policy? A vaccination policy is a health policy adopted in order to prevent the spread of infectious disease. These policies are generally put into place by state or local governments, but may also be set by private facilities, such as workplaces or schools. Many policies have been developed and implemented since vaccines were first made widely available. The main purpose of implementing a vaccination policy is complete eradication of a disease, as was done with smallpox. This, however, can be a difficult feat to accomplish or even confirm. Vaccination policies vary from country to country, with some mandating them and others strongly recommending them. Some places only require them for people utilizing government services, like welfare or public schools. A government or facility may pay for all or part of the costs of vaccinations, but it may vary in real time as per the need. Thank you, doctors and nurses.